The Syntax trial was conducted to assess non-inferiority of PCI with drug-eluting stents. It was an international multi-center randomized trial in 1,800 patients with 3-vessel and left main disease, and they were randomized to PCI with drug-eluting stents versus coronary artery bypass grafting. They looked into a composite endpoint of MACE, major adverse cardiac and cerebrovascular events. And today we're presenting at ESC the final 10-year survival data, so all-cause death in the 1,800 patients from the Syntax trial. Here at ESC 2019 in Paris, we will be presenting the final 10-year survival data of the randomized patients in the Syntax trial. It is different than what we presented at TCT last year, 2018, where we presented the preliminary data of all-cause death, and we expected that the data was completed. However, unfortunately, it was not. So therefore, now we have obtained 94% of completeness of follow-up of the randomized patients and present the final all-cause death data in PCI versus CABG. Syntax will continue to influence practice as it is, of course, a pivotal trial. It was over 10 years ago. The 1 and the 5-year results have been presented. Today we present for the first time in a large randomized trial with drug-eluting stents versus CABG in patients with 3-vessel and left main disease, the final 10-year data. Data that long is limited, so therefore we believe it will influence practice, and of course will provide the most robust outcome, which is robust for patients and physicians on all-cause death. The questions that remain unanswered now, although we've presented the final all-cause death data, we looked into the most robust outcome. Of course, you want to look at different outcomes as well, certainly for a patient and as a physician. For instance, stroke, repeat revascularization, myocardial infarction after CABG and PCI are important endpoints. We've been able to show all-cause death. However, probably for the more contemporaneous trials with newer generation stents, we would hope that follow-up is prolonged up till 10 years as we did.